Well, thank you. And some of what I'm going to say today is related to what I talked about yesterday. The nutrition and immune function and the things that you do to build your system. It's a lot of what we're going to talk about with long COVID. But I'll just start by saying that last year I took the month of December because I'm such a party girl, and I spent about 200 hours looking into this. And the reason I was interested in getting to the bottom of long COVID is because millions and millions of people are claiming to be afflicted. And what I wanted to figure out is this something unusual that we've never seen before? Because people have trouble recovering from the flu sometimes as well. Or was this just tied up with all the hysteria that normally goes with everything COVID? So anyway, I'm going to share with you what I found out, and hopefully you'll find it helpful. And I have slides which are mostly to keep me on track, not because they're particularly fun for you to watch. But anyway, long COVID, what is it, who has it, and what to do about it? And this is the significantly abbreviated version, because the entire lecture, even before we get to questions, if I delivered it in its entirety, would be a little over 3 hours, and that's a little bit long for a Sunday morning. So we'll see what we can figure out looking at the abbreviated version. I think I can give you the general idea. So the first problem that we have in investigating long COVID is the definition is fuzzy. It really does depend on who you ask. And another thing is that the idea of having trouble recovering from an infection, respiratory, gastrointestinal, whatever, is not new. I remember about 20 years ago having an employee who got food poisoning, and she was acutely ill for a couple of days, but even 2 or 3 weeks later was saying, I just don't feel right, and my stomach isn't right, and that sort of thing. So this is not a particularly unusual situation. Long COVID is a syndrome, not a disease, because the spike protein, which causes the problem, travels everywhere in the body when you have been infected. Doctors and researchers are hypothesizing a lot about what might help, for example, supplements, and a lot of discussion of potential metabolic pathways and interactions, not a lot of evidence. But another reason I want to look into this is that it's becoming very lucrative to specialize in the long COVID space, which I think is a little disingenuous, and I wanted to be able to present an honest version of what is going on out there. A lot of elaborate explanations and exotic treatments are offered for like inflammation. I mean, inflammation is something we have dealt with in healthcare for as long as I've been in healthcare. It's not unusual. It's not just associated with long COVID, and suggesting that there's some kind of special thing that you do for inflammation, people who experience inflammation associated with long COVID, is just a little crazy, in my opinion. And so I started to see right away, as I looked into this, that you want to go for the low-hanging fruit, a conservative approach. And so when I explain what I do to people who aren't familiar with my work, I tell people, look, the most likely, simplest explanation for something is what you want to assume until you know better. So I've always taught by analogy. So the way I explain it is, look, I live in Columbus, Ohio, and if I hear hoofbeats outside my window, it is probably deer, most likely deer, actually. Now, animals escape from the zoo, so there is the possibility that we could have zebras in my yard. But before we start building concrete barriers and battening down the hatches around here, I think we could safely assume for the time being that it's deer, because it would really be rare to have zebras in the yard in Worthington, Ohio, ever, right? Okay, so that's how we're going to look at this. So the official term, there are a lot of different terms, but the most commonly used is post-acute sequela of COVID-19, or PASC, and it's characterized by symptoms that persist after initial infection. And one of the challenges in researching it is that there are a lot of different terms used to describe it: long COVID-19, long haul COVID, post-acute COVID-19, et cetera. And so if you're doing literature searches like I was to find out what are people publishing, what are they saying, even case reports can be instructive. You run the search a whole lot of different ways because different people are referring to this by different names. So the definition is broad and in fact begins to encompass anything that has bothered people, sometimes for a decade, before. All right. So symptoms, signs, abnormal clinical parameters that persist 2 or more weeks post-COVID and don't return to baseline. But a lot of these case studies and studies in general don't really account for the fact that some of these people were pretty sick before they got COVID. In other words, yesterday, if you listen to my lecture on nutrition and immune function, which bears on COVID because, COVID is a function. If you get sick, depressed immunity leads to illness. But my point is that the most likely people to develop severe COVID were people who are overweight, diabetic, and hypertensive, many of whom were medicated and had other comorbidities too. So what happens in this post-COVID, long COVID space is that nobody's accounting, or very few are accounting for the fact that sick people got sicker and then had trouble recovering. And as I'll show you when we get into what to do about it, a lot of it is looking at what was wrong before and fixing that. And then, like magic, the long COVID goes away too. So age, gender, underlying health conditions, viral dose, risk factors, physical deconditioning as a result of being ill for a long time, physical and mental health issues resulting from being sick for a long time, and also resulting from just the terror that people experience for a very long time about this. And then social, economic, and environmental stress resulting from the pandemic itself. So, let's take your overweight, diabetic, hypertensive, not doing very well person who has 2 children who are schooling at home and then gets COVID and is economically distressed because of inability to work. And is it shocking that the person has become sicker after this? And then how do you unpack all of that and help the person get well? And so it's distressing for me to see that some people are just proposing, buy my supplement packs and all this sort of thing, because I can't fathom how all this that I just described to you could possibly be dealt with 6 supplements and, good luck with the rest of that. That's never how we've been able to help people get well over the 27 years we've been in business. It's always with a total person approach, whole person approach. Nobody knows how many people are affected. And just to give you an idea, one GAO report from the government said it's somewhere between 7.7 and 23 million people. And that's a pretty broad range. And so that tells you that the condition is in the eye of the beholder to a certain extent. The estimation is that about 1 million people are unable to work. And of course, that's another subjective thing that we could look at too. But we're going to focus on the physical. So the common symptoms, here's the list. And as you can see, it's everything. It's everything and anything gets lumped into long COVID. And by the way, one of the difficulties of this is we don't really even know who had COVID because we were using a test with 100% false positive rate based on when it was used before. So, who knows what's really gone on. I believe some people did have COVID, but again, was it the COVID or was it the underlying conditions before that make the difference? So mood changes and headaches and cognitive impairment or brain fog, those are things people were complaining a lot before there was any COVID. There's a lot of crossover to other syndromes like chronic fatigue, postural orthostatic tachycardia syndrome, or POTS, mast cell activation syndrome. And the same symptoms were reported following infection with other coronaviruses. So again, not new, just bigger, and a lot of crossover with some of these other conditions, which, as it turns out, when we've taken histories on people, they were often suffering from before they had SARS-CoV-2. There are no lab tests that definitively confirm long COVID and can clinically differentiate it from a very long list of conditions that exist separate and apart. A positive COVID-19 test isn't required, and most of them don't mean much anyway. So the way that you have to look at this, if you're a responsible practitioner, is take a history, look at the symptoms, perhaps a physical exam and testing. We don't do that in my office, but most people have been tested enough by the time they get to us. They really don't need any more testing. Clinical testing can cause harm. And we've talked about this in many of my lectures that I've delivered at this conference before, the danger of the more you test, the more you find. The older the person is, the more there is to find. And the question is it an incidental finding? And incidental findings make people just as nervous as the ones that are being deliberately looked for. A lot of anxiety about abnormal results that aren't clinically significant. In fact, one of the things that I'm bothered by almost every day in my office is that 27 years ago, people used to get a blood test or a lab test in their doctor's office, and it was 2 pages long. Now it comes in a UPS box because they're looking at so many different things. And on the surface, that can sound like a good idea. But the problem is, again, the more you look, the more you find, and you see all these flags, little tiny differences that probably would be different if you took the specimen 15 minutes later, but they make people nervous. And the medical system benefits from people who are nervous about their health instead of confident in their bodies, which we talked about yesterday. And then time and money invested in medical appointments. So again, when people come to us and say, I think I have long COVID because I had it, and I was really sick for a week, and it just seems like I've never been the same. Before we start testing to find exotica, let's go for the low-hanging fruit. Again, we're in Ohio. Let's assume it's deer, not zebra. And we haven't had a case yet where that wasn't the situation, where if you look at the diet and the habits and the physical status before, you find your problem right there. So I mentioned this before. One of the big issues is the faulty testing. And so I tell people, look, it doesn't matter what you had. You say you were sick for a week, I believe you, or 10 days or whatever it was, all right? You say you were sick for a week, I believe you. You say you feel like crap right now, I believe you. I'm looking at your medical history, not shocking where you are right now. And I also think you have to allow some time to get better. In other words, I'm concerned about the person who is not better a month or two later or longer. I'm not concerned about the person who says, last week I had the flu or COVID or whatever it is, and then it's Monday of the following week and I'm not back to myself. I've had the flu 3 times during the last 27 years. And by the way, every single time it had nothing to do with my physical health status as much as it did the stress that I was under at the time, which is why I remember the times that I had the flu. It's because things that were going on in my life were very stressful. And so, you're sick as a dog for however long it is, and then it's a couple weeks to recover. So I want to really differentiate that it doesn't matter what the person's test says. It matters what they're telling you about their symptoms and their state of health and their history and all that kind of thing. And we're looking at a time differential that's really important. 2 weeks later, I'm not so concerned that you're not back to normal yet, but 2 months or a year later, this is highly concerning and deserves looking at. So SARS-CoV-2 is not unique in causing post-infection sequelae. And so if you take a look here, I'll show you some other examples. If you survive Ebola, you are likely to have a whole list of problems ranging from inflammatory conditions of the eye to numbness and tingling and difficulty swallowing and fever and stiffness in joints. And Ebola is a pretty serious disease, not shocking, right? Polio, it can reemerge 15 to 40 years after initial illness. And I'm of a generation, I'm in the same generation as some people who had actually had polio, and I've seen this happen with acquaintances of mine. West Nile virus, motor disturbances, and muscle weakness. So this is a common thing, fibromyalgia or IBS or chronic fatigue after an infection. So it's not mysterious, it's not new, and having difficulty recovering from some type of infection is not, even people who have taken an antibiotic for a respiratory, for a bacterial infection have said that sometimes it takes a month to get back to normal after taking an antibiotic for 7 days, all right? Now, I'm telling you this not because I want to discount the suffering that people have. We want to relieve the suffering that people have. Well, I think part of it is a psychological issue where we don't want people being panicked about their health, right? Oh my gosh, everybody hears all these horror stories and I'm never going to get well again and I have some exotic thing wrong with me. So just knowing that it's not quite so exotic maybe puts a little bit of, takes a little stress off the situation. So some of the categories of people who have what we're referring to as long COVID, people who had severe COVID and might have lung or other organ damage as a result of pneumonia or acute respiratory distress syndrome. And again, that can be a function of age and comorbidities that existed before. lingering symptoms after being in the ICU, if you were lucky enough to survive. Syndromes characterized by unexplained exertion intolerance, fatigue, cognitive and sensory disturbances, people who continue to have respiratory symptoms that like dyspnea, shortness of breath, chest pain, and then notoriously a lot of people with taste and smell issues, and those tend to occur independent of the other symptoms. So the prognosis, again, we'll look at some of the other conditions that frequently have long-term sequelae. And so if you look at adolescents and young adults, you get mononucleosis from initial 30 to 40% of cases with persistent symptoms for several weeks. The prevalence drops to 8 to 14% at 6 months and 7 to 9% at 12 months. And some studies have even shown longer duration. And so this goes to something, when I'm talking to somebody who has long COVID, who says, I can't get well, one of the things that you want to look at is, are you better than you were last month at this time? Because if you're better now than you were last month at this time, maybe you're just one of these people who's going to take a year to get better. Now, that doesn't mean we don't want to change your diet and hydration and all that sort of thing, but sometimes people really haven't stopped to think that I'm miserable, but I'm getting better. And so if you're getting better and you're on the road to recovery and you're positioning it that way instead of I'm miserable, that has a huge effect on your psychological state. And believe me, psychological state has a lot to do with physical health. Another study that looked at 157 people who had West Nile virus in Houston, 40% continued to experience symptoms up to 8 years later. And of course, what that tells us is that if you're still sick 8 years later, then either your state of health might have been terrible, that's often the case, and we should be doing something for these people. So someplace between you're getting better and maybe in a few months you'll be all better versus you're sick 8 years later is where we usually find people. An Australian study monitoring patients with a variety of different viruses. Illness for all three infections showed time-dependent decreases in symptoms. So we went from 35% down to 27, 12, and 9% after 1.4, 3, 6, 12 months respectively. And by 6 months, 11% were found to have symptoms, right? So again, there is a time factor, and people are impatient. And I'll tell you what, I'm a bad sick person. If I'm sick, I hate it. I don't like having any reason not to be able to go, full force, 18 hours a day and all that sort of thing. But there is a time to just be patient and say, listen, this knocked me on my butt, and maybe it's a wake-up call for me to take better care of myself. But having said that, some patience to let myself heal. You can't just flip a switch or snap your fingers and everything's fine. So specific to long COVID, a meta-analysis of 15 studies, the subjects were comprised mainly of patients who were hospitalized for acute COVID-19. 80% at 100 days after infection, 80% reported one or more long-term symptoms, 58% fatigue, 44% headache, 27% with attention or concentration limitations, 25% hair loss, and 24% shortness of breath. And of course, these are symptoms normally reported sometimes with people who don't take very good care of themselves. So I would say, at least at this point in time, all the long COVID patients we've seen have had pre-existing conditions that, if you address them, sped the process of healing and often resolved much of this. Longitudinal prospective study of adults with lab-confirmed SARS-CoV-2 infection followed up for 9 months, a high proportion with mild disease, 30% reported persistent symptoms, and fatigue was the most common symptom. And by the way, I used to talk to people every day before COVID about people being tired. People ask me all the time, I'm 66 years old, you are always so energetic. Well, my diet, my lifestyle, everything about the way I take care of myself facilitates operating a human being at high energy all day long, which people were not doing before COVID. During the lockdowns and everything else, I think everybody's habits got significantly worse. And so it was just the perfect scenario for people to get sick and be sicker than they normally would have been. prospective study of 50 lab positive and 50 lab negative patients. Authors note lack of antibody detection despite evidence of active infection has been demonstrated with other viruses, including hepatitis C. Some long COVID patients previously infected but with symptoms were seronegative. So again, the testing is very faulty. And again, you see the same thing here. Let's go on to the next slide. The authors wrote that the increased female to male ratio and comorbidities suggest autoimmune etiology of long COVID. There does seem to be some of that. And then instead of considering it exotica, we've worked with autoimmune patients for years and years, and we treat them as an autoimmune patient, right? And many of them were trending toward autoimmune before COVID, and then it appears that sent them over the edge, one of the reasons being that their immune system went into overdrive to try to fight the infection, which triggered the already brewing autoimmune disease, right? So pre-morbid depression, anxiety prevalent in 42%, versus 21.4% of all adults suggest a possible neuropsychiatric vulnerability to developing long COVID. The authors also suggest that constellation of symptoms, especially fatigue and cognitive dysfunction, resembles chronic fatigue. So one thing, this whole idea of who has long COVID, what is it? It's a moving target. It's anything you say it is. There are a couple of studies I want to show you that indicate that we are just calling everything long COVID right now. So this particular study looked at 300 adolescents who definitely had COVID-19 with 85 controls who definitely didn't. And there was follow-up for 6 months, and the primary endpoint was post-COVID conditions. The COVID group, 48.5%. The no-COVID group claimed the same symptoms, 47.1%, where there's no difference, right? The secondary endpoint was fatigue. The COVID group, 14%, the no-COVID group, 8.2%, not statistically significant. Now, please don't misread what I'm saying. If you say you're tired, I believe you. The point is why. We have to figure out why. And as long as you blame it on everything on long COVID, and then you have these people out there saying, take my 6 supplements and long COVID goes away, you're never going to fix this problem. You're just going to exacerbate it. And that's so often what happens in the healthcare space is people think they have something, they go out and look for easy solutions, and they spend a lot of money before they get to us. Very often they've spent a lot of money. Having or not having COVID made no difference in this cohort. What did make a difference is female sex and psychosocial traits such as neuroticism and emotional maladjustment. And so it's not so much that it's in your head. The point is that what's in your head is not productive, and you have to fix that in order to be a healthy person. So the idea of people having persistent symptoms and that sort of thing, that are related to their mindset is not new. And in a different section of this conference, I was involved in a panel discussion, and Steve asked me about, what happens when people come to you and they change their diet and they do all these things? What can people expect? I said, well, it's highly variable, because first of all, people are in different conditions when they show up. But the other thing is their mindsets are different. And there's a great book I've recommended a lot called The Expectation Effect. And I just want to show you how clear expectation is in health. The first story in the book involved a guy who was diagnosed with cancer. And he recovered, and then his doctor told him bad news, it recurred, and they don't even see you lasting until Christmas. He made it till New Year's and died. And on autopsy, they found out that he didn't die of cancer. There was no cancer in his body. He died of expectation. And so to get well, you have to want to be well, right? And we can't help people become healthy who aren't interested in becoming healthy. So what we're dealing with here is psychosocial traits that have to be addressed. And so again, everything getting lumped in with long COVID. A review of studies, Vinay Prasad was one of the researchers that published this. He's a phenomenal researcher, by the way. We don't agree on everything, but I find his perspective refreshing because he just calls things like they are. They looked at 80, he and his researcher partner looked at 83 studies. They found 3 randomized controlled trials. Most of the rest were observational. And the problem is serious limitations in the studies. They lack control groups. They don't control for confounders. There's no standard definition, and some studies show clear bias. So again, you just have this soupy mess of everybody claiming long COVID. Do some people have symptoms associated with having the flu and difficulty to recover? Yeah. Figuring out what's what is important. And there is a lot of money right now in calling everything long COVID and prescribing magical solutions for it. So what I'm going to do now is I'm going to go through and we're going to look at the various symptoms that present as long COVID. We're just going to call it that for now. And then what you do about it, because that's the real issue. I don't care what label you put on it. All right, so we know that the spike protein has a particular affinity for the ACE2 receptors, which means it's going to affect the cardiovascular system. And so if you have damage to the endothelial tissue that lines the blood vessels, you're going to have a lower production of nitric oxide, a vasodilator, and impaired vasodilation results. And then, of course, think about the high-fat diet with all that thick, sludgy blood that it creates, and the dehydrated patient with thicker, sludgier blood trying to move blood through shrunken blood vessels with less nitric oxide being produced. All right, so basically, what you do with this is you get people hydrated and prescribe a plant-based diet, a low-fat plant-based diet. And eventually the endothelial tissue starts to come back to life and nitric oxide production increases and hydration plumps up the blood plasma, and you don't have the thick, sludgy blood trying to make its way through narrowed vessels. And then this is a really interesting study that I use because it just goes to, no matter how healthy you are, there's healthier to get if you aspire to be, but it just goes to what I'm talking about. So endothelial progenitor cells are made by the bone marrow, and then they're converted to endothelial cells that line the blood vessels. These are the ones that produce the nitric oxide. This very interesting study in Okinawa, they had 45 healthy young women randomized to either continue their current diet or to get some extra servings of Okinawan vegetables every day for 2 weeks, all right? So both groups had folic acid levels increase and homocysteine levels decrease, but the change was statistically significant in the women who ate the extra vegetables. And circulating endothelial progenitor cells increased in the group eating the extra vegetables. And so my point is that if you can make incredibly healthy people like the Okinawan women who routinely live to be over 100 years old, if you could make them healthier doing this, think about the effect that you will have on people who are unhealthy, who agree to, they don't have to eat Okinawan vegetables, they just have to lower the fat, increase the fiber, and really load up on the plant food as opposed to what their diet looked like before. Autophagy is the body's cellular recycling system. It's involved in programmed cell death and eliminating pathogens, and it's like the quality control system for the body, taking out the trash, as it were. Over time, parts of cells become defective or stop working, and the cell breaks down and discards old tissues, and you recycle the stuff that's usable, and then autophagy cleans house. So it keeps cells functioning properly and optimizes performance. Immune dysfunction resulting from SARS-CoV-2 or any other infection can reduce autophagy. So as autophagy is reduced, inflammation levels increase. Dysfunctional monocytes secrete pro-inflammatory cytokines, which increases inflammation even more. And this can begin to have a negative effect on taste and smell. This is some of how taste and smell were damaged during COVID. So disruption in autophagy can cause mitochondrial dysfunction. Fatigue is a hallmark symptom of mitochondrial dysfunction. Disruption in autophagy results in accumulation of dysfunctional mitochondria and can lead to severe cardiomyopathies. And also mitochondrial dysfunction is also a hallmark of cancer as well. So good reasons to pay attention to this. Disruption in autophagy can also cause microvascular damage and endothelial dysfunction. So again, an endothelial dysfunction can cause all kinds of problems ranging from shortness of breath to postural orthostatic tachycardia syndrome. So what you want to do is encourage autophagy, and if you can, detoxify the spike protein. So one of the incorrect claims circulating out there is that autophagy requires intermittent fasting, like eating within a window every day, and or a low carbohydrate diet. And that is not true. First of all, the low carbohydrate diet's an insane proposition. Some people are talking about keto diets for this. All right, so you already have endothelial tissue damage. You have lower production of nitric oxide. You have significantly increased risk of coronary artery disease. And now you're going to eat a high-fat diet. There is a place for a keto diet, but this is truly insanity at its extreme. And the other thing is that I have never understood why we want to make this harder than it needs to be. There is zero evidence that eating within a window improves any marker of health as compared to just eating well and taking care of yourself, right? So autophagy can be improved with good habits. I'm going to show you that right now. We'll come back to medically supervised water fasting, which does promote autophagy, distinctly different from trying to eat between 8 and 4 every day, which I don't want to do, and I'm pretty motivated about health. And then we'll talk about some different supplements that may play a role, not by themselves. This whole idea, you go online and buy a 6-pack of supplements and fix all these problems I'm talking about, it's fantastical thinking. All right, so exercise and sleep, shocking, right? I mean, again, the low-hanging fruit, the deer outside the window, not the zebra, that's where we want to go to fix this problem. So exercise induces autophagy in organs involved in metabolic regulation, such as muscle, and then in the liver and the pancreas and the fat tissue. Treadmill exercise was shown to induce autophagy in animals. Getting the right amount of sleep triggers autophagy. And by the way, the right amount of sleep, even that is so misrepresented. We have people out there saying all adults need 7 hours of sleep. Great book. I can't remember the name of it right now, but we talked about it in our Healthy Book Club a few years ago. It was written by the guy who set up the Mayo Clinic's sleep clinic before they started drugging everybody. And one of the things that he outlines in the book is the evidence for varying sleep patterns in adult humans. Like some people are short sleepers, medium sleepers, and long sleepers. So the right amount of quality sleep varies from person to person. I happen to be a short sleeper, and the longer you try to get me to sleep, the groggier I am. Wake up a long sleeper in the time that I sleep, and the person will crawl around on the floor all day. So that's a very individualized thing, but there's no question that sound sleep and enough of it induces autophagy every single day without any other party tricks or supplements or whatever. Heat induces autophagy and has been proven to do it. Mild heat stress has been shown to induce autophagy in various single cell organisms. And so some suggestions for heat: sauna and steam rooms, hot yoga, outdoor activities, and warm or hot weather. It's going to be nice and warm in Columbus today. So one of my afternoon things will probably wait till the heat gets the highest, and I'm going to go for a nice run down to the river. Fresh air, sunshine, produce some vitamin D. This is all good for promoting health in general and autophagy specifically. Acupuncture can be effective, not by itself, but as an adjuvant treatment. It's been shown to promote autophagy and restore mitochondrial and lysosome structure in mice with Parkinson's disease, for example. Diet, and not this eating within a window crap, and certainly not a ketogenic diet, but believe it or not, coffee has been shown to induce autophagy, and it may be one of the reasons why epidemiological studies and clinical trials show that coffee is actually associated with better health. I had one of my colleagues look into this, and she wrote a long paper. And the research is very clear on coffee. You've got a tiny percentage of the population that is caffeine sensitive and shouldn't have it, right? And certainly you shouldn't take up the coffee drinking habit if you don't like it. But for most people, it's actually beneficial. And believe it or not, the sweet spot for disease, if it contributes at all to disease prevention, seems to be 3 to 4 cups a day. So no reason to give it up if you like it. No reason to add it if you don't. But the point is, coffee's been villainized for reasons that I don't entirely understand. EGCG, we talked about yesterday, a polyphenol in green tea has been shown to increase autophagy and to induce lipid clearance in mice fed a high-fat Western diet. So the point is not to eat high-fat and drink green tea. The point is to marshal all of the possible strategies toward optimal health that you can, all right? And it's also been shown to increase autophagy in human cell lines. Low sodium levels are common in COVID-19 patients. And this is kind of an interesting thing to talk about because along with coffee, sodium seems to be on the hit list of things to villainize these days. And we do have taste receptors for sodium, for salt on our tongue, which should tell us something. And it's a necessary nutrient. A study of 132 hospitalized patients between 51, mean age 51. Hyponatremia was found in 84 patients. That's a pretty high percentage. Patients with COVID-19 disease had 2.15 times higher odds of suffering from hyponatremia. And several studies have reported the link between hyponatremia and hospital admission with COVID and transfer to ICU, use of ventilation, or death. And so I'm very concerned about this new trend toward restricting all added salt to the diet. I had a friend who spent 3 days in an ICU long before COVID, strictly because he had depleted his salt stores so much between restricting salt and sweating and hot yoga and other athletic endeavors that he ended up hospitalized. And so, most people reduce their salt when they stop eating so much processed garbage and less animal food and increasing whole plant food. There's no further restriction needed. There's another issue, and someday maybe I'll do a whole lecture on salt in this for this conference, but there's another issue which has to do with the ratio between sodium and potassium. And the bottom line is that if you upset that ratio, you end up with health issues. So when you eat a health promoting diet, your sodium levels are lower, your potassium intake is higher, and everything's just swell. You start some extremism on either side, and you can mess things up pretty well. So some causes of hyponatremia are medications, in particular, can do it. Diuretics are famous for it, antidepressants and pain medications, vomiting and diarrhea, drinking too much water. And that's, you can kill yourself with too much water, too much of a good thing. You have to look at that sometimes too. A very famous episode was a woman who died running the Boston Marathon because she drank too much water. She actually gained weight running the marathon, and by the time she was far from the finish line, she had put on weight, she had drunk too much water, and her sodium levels were dangerously low. And then restricting salt intake for a period of time. The other thing is drinking reverse osmosis and distilled water, which will eventually wash out all your electrolyte stores. So not a bad idea to drink distilled water for a water fast or something of that nature. Not a great idea at all to consume distilled or reverse osmosis water on an ongoing basis. Sooner or later, you'll have problems. I found a couple of case reports that I thought were interesting, mainly because the solution is so low tech and low cost, it might be worth looking into for some people. And that is the use of just plain everyday antihistamines. And then, of course, there are other things that you could do that serve the same purpose, but and I'll get to that in a minute. So here's the first one. A female in her 40s, normal weight, had acute COVID symptoms for 24 days, which is a long time. That is a red flag right there. Partial resolution, but she had persistent rashes, flank pain, bilateral chest pain, right-sided headache. Her hair fell out, bruising, oral ulcerations, fatigue, and brain fog. Her lab tests and ultrasound were all normal. So what happened, it was an accidental finding. She ate some cheese that she turned out to be allergic to, and she took some Benadryl, 50 milligrams, and the next day, she was able to concentrate. Her fatigue was better. After 72 hours, her symptoms returned. So she took Benadryl again and eventually got a prescription antihistamine, and nearly complete resolution of exercise intolerance, chest pain, brain fog, and fatigue resulted. She also had decreases in headache, rashes, bruises, and oral ulcerations. We was able to return to work, exercising 1 to 2 hours a day. And so you could accomplish the same thing with drinking filtered water, salting your food, and eating a health-promoting diet. But the taking of the antihistamines while you're fixing all of the things that need to be resolved would certainly not be a bad idea. I don't like lifetime prescription of antihistamines, but as a transition to healthier living, that could work well. Here's another one, middle-aged female teacher, normal weight, but did have asthma and seasonal allergies. So again, this would be an example of the pre-existing conditions that lead to this. Sick with COVID for 3 months. All right, so pre-existing conditions, you get sicker for longer. Developed tachycardia, post-exertion fatigue, joint pain, insomnia, a whole intermittent taste and smell disorders, difficulty concentrating. This went on for 9 months, and some of it got worse, and she developed abdominal pain and bloating. So remember, if you listened to yesterday, we were talking about probiotics and the role of restoring the gut microbiome, both to prevent and treat COVID-19. She also took an antihistamine, and the next morning the brain fog and fatigue resolved, and she continued to take it, and a lot of other things got better, and she's now 95% of pre-illness function. Again, using the antihistamines as a bridge while you're fixing the other things, because clearly this woman was sick before she got COVID. She had asthma and seasonal allergies, neither of which are in normal state of good health, right? Another thing that is an interesting solution is halotherapy, the use of salt vapor to relieve symptoms of many conditions, including respiratory disorders. It's not new because it goes back to Hippocrates, use salt to treat respiratory conditions. And again, it's baffling to me how salt became so vilified. It's just baffling. 1843, a physician observed that Polish salt miners didn't seem to get respiratory disorders. During World War II, Dr. Karl Spanagel reported that his patients improved while hiding in salt caves in Germany to protect themselves from aggressive bombing. And those hiding in the caves said, gosh, my coughing went away, my breathing got better. The Russians actually developed the first technology that would allow the duplication of salt caves outside of the salt cave, actually going into a salt room. An article in a 1902 issue of The Lancet advocated the use of salt for the treatment of upper respiratory conditions. And a 2009 survey of family practice doctors showed that 87% of them had recommended salt treatment for one or more conditions, and we certainly recommend it. Salt caves have been used in Eastern Europe for a very long time. It's actually referred to as speleotherapy. And so it's just the recreation of a salt cave for therapeutic purposes. If you go to almost every major city has one. There's one very close to my office that's owned by a client of mine. It's a beautiful place. I like going there just because it's a beautiful place. But the rooms are warm and slightly humid, and then dry sodium chloride particles are infused into the air, into a really clean room. It's been shown to help patients with breathing problems and also patients with asthma, infectious disease, and inflammatory conditions. I've been sending people to salt rooms for years and years and years. And when they started becoming a thing around the country, I visited one a few times just to see what it was like. I'm reluctant to send people to do something I haven't checked out myself. And what happened was kind of interesting. I visited the salt cave because I wanted to see what it was all about. I didn't have anything wrong with me that I knew about, so I didn't expect anything to get better. But what did happen, and it was just an incidental thing, is I noticed that my sense of smell got better. This was years ago, like 10 years ago, 8 years ago. And so obviously with one of the main problems with long COVID being the loss of smell, I would recommend at least trying this. It's not expensive and there's nothing that can go wrong with it. A study of 193 patients and matched controls with respiratory disease, significant improvement in symptoms with the use of dry aerosol over placebo in mild and moderate cases, 75% in severe cases, 97% in chronic bronchitis. So again, not much can go wrong. The best, you'll come out feeling nice and relaxed. For me, it was like having a mid-afternoon nap, which I never get time to do. There are several mechanisms of action. It cleans out the nasal passages and removes inflammatory mediators, may help to restore a sense of smell. Multiple trips might be needed for somebody who's lost their sense of smell as a result of COVID. There are lots of randomized controlled trials that support saline irrigation. In other words, the use of salt as treatment is not really anything that anybody disputes, neti pots and that sort of thing. Even Cochrane review showed that saline solutions were beneficial when either used as an adjuvant or alone. So how we got into vilifying salt, like I said, is kind of baffling to me. We talked just a little bit more information about something I talked about a lot yesterday, which is the role of the microbiome in COVID and long COVID. Prospective study of 106 patients with a broad range of symptom severity and 68 non-COVID controls. At 6 months, 76% of them had PASC. Those common symptoms we saw before: fatigue, poor memory, hair loss. Patients without it showed recovered gut microbiomes at 6 months. Patients with PASC had higher levels of negative bacteria. And so the persistent respiratory symptoms seem to be correlated with the opportunistic gut pathogens. So some people had guts that restored themselves, and some people had guts that may have been already on the way to being compromised because of pre-existing health status, and they needed some help to be restored. The butyrate producing bacteria, which is an anti-inflammatory substance, was the largest inverse correlation with PASC. And so anyway, what this tells you, again, is that pre-existing health status matters. And also another thing that you can try, and none of this stuff is expensive that we're talking about. Salt, visiting the salt room for an hour, not expensive. Probiotics, not expensive. And changing your diet probably will cost you less money rather than more. That'll pay for the salt room and the probiotics. So just paying attention to the basics of health really seems to be what the long COVID thing is about. Another study with 320 cases and 280 controls, SARS-CoV-2 was associated with increased incidence of functional gastrointestinal disorders and disorders of the gut-brain interaction at 1, 3, 6 months after infection. Psychological counseling and probiotics would be the solution for that. 126 subjects with long COVID for an average of 108 days were given a probiotic containing lactobacillus and an inulin or prebiotic for 30 days. Cough, fatigue, subjective well-being improved significantly. Gut symptoms improved in 25 out of 31 patients. Usually there's more than one thing going on, and depression, anxiety, worry, perceived stress, loneliness before SARS-CoV-2 was associated with a 50% increased risk of developing long COVID and a 15 to 51% greater risk of impairment in daily life. And that psychological stress had a bigger impact than physical risk factors like smoking or comorbidity. So that's why we want to talk to people, why you have to take a whole person approach, because in many cases, this is what I've observed in my own clients, you take a person who's not really healthy to start with, starts working at home with an enormous amount of stress, isolated, daily life interrupted, person gets COVID. So they were not in great health before. They're in worse health and a worse psychological state now. Now they get COVID, they have trouble recovering, which makes their psychological state worse. It's like a downward cycle from hell, feedback loop from hell. And so to break out of that, you have to deal with the psychological issues and the gut issues and the health issues. And so, again, you can see as this goes on, as I'm sharing this with you, the craziness of saying, buy our supplement packs and it fixes all of this. It's not gonna. An analysis of 2-year retrospective cohort studies of patients diagnosed with COVID compared with matched control. Mood and anxiety disorders were transient. There was no greater incidence of these diagnoses compared to those with other respiratory infections. In other words, part of the panic, I think, is that people think it's special to COVID, and it's not. Increased risk of psychotic disorder, cognitive deficit, dementia, epilepsy, and seizure, a much higher risk at 2 years after infection with SARS-CoV-2. But again, you can tie that back to pre-COVID health status. The risk of death was significantly higher for older adults diagnosed with neurological psychiatric sequelae after diagnosis of COVID-19 and other respiratory disorders. And I think that's why a lot of our elderly died. Isolated and living in a room with no human contact. It's hard to imagine that if those people had COVID, many of them would have died of COVID anyway by virtue of their age and comorbidities, but those who could have been saved were probably killed by the isolation and psychological stress. The risk is lower for children except for those who have, again, comorbidities like epilepsy or seizures. Even mild infection can affect the brain, particularly if you're not taking very good care of your brain before you get an infection, which most people aren't. And by the way, we don't have time to go into this right now, but what's good for the cardiovascular system is good for the brain. So cardiovascular disease is the leading killer of people in the United States. So you can just imagine what we're doing to our brains, right? The UK biobanks biospecimens from 785 patients, half with COVID, infected with COVID, half not. 95% of them were not hospitalized. They were mild cases, but MRI before and after infection showed structural changes in the brain. There was a significant reduction in brain volume, which is a risk factor for dementia. areas of the brain with reduced volume had to do with decision making and cognition, emotion, memory, and that's where your brain fog comes from. But this is what's really exciting. You can rebuild your brain a lot of ways. Food is one of them, but with exercise, people who exercise have physically different brains. That's why I'm so smart. Actually, I'm just kidding, but you get my idea, right? The hippocampus, which is the key for memories, is stimulated by exercise that increases heart rate. So when I go run down to the river, I'm going to be doing something good for my heart and good for my brain. Out of shape people grew new blood vessels in the hippocampus after just 12 weeks of exercise. Aerobic exercise, good for the heart, good for the brain. Any activity that increases blood flow promotes better brain health. Just think about it. Your cardiovascular system is the delivery method for oxygen and brain to the brain and water and nutrients, right? Exercise has been shown to reverse age-related shrinkage of the brain. So if it can reduce age-related shrinkage, it can reduce COVID-related shrinkage. It positively impacts several comorbidities with long COVID, like cardiovascular disease, type 2 diabetes, high blood pressure, and high levels of aerobic fitness are associated with increased hippocampal volume. And so one thing that I really think is important is interventions where there's a breadth of effect, right? Instead of you got an intervention for your blood vessels and an intervention for the brain and an intervention for this and that. Well, when you talk about changing your diet, taking a probiotic, exercising, you're talking about essentially the breadth of the effect. It affects everything. Your habits affect everything, and that's so much better than this reductionist idea. You take a supplement for this and a drug for that, and you live your life differently, and you impact the entirety of your health. Aerobic activity increases something called brain-derived neurotrophic factor, BDNF, and that increases neuroplasticity and increases endothelial growth factor. Structured exercise lowers inflammation within only 4 weeks. Klotho is a hormone associated with longevity and protects against cognitive decline. And your klotho levels start to increase after only 20 minutes of intensive aerobic exercise. So, there's exercise and there's exercise. I'm sitting in the front of my house in my front office, and in my neighborhood, I see people strolling along. They stop and talk to the neighbors, and they're walking their dog. And I think it's great. You're outside and you're walking around and you're with your dog, but that's not what we're talking about here, right? We're talking about doing something much more aggressive. 59 older sedentary adults engaging in aerobic exercise 3 times a week at 6 months. The gray matter was larger in the frontal lobe areas, memory and attention. The white matter was larger in the area that facilitates communication between the left and the right side of the brain. So there's just common sense interventions that you would recommend to anybody who wanted to improve their health. We get a lot of people who've never had really any diagnosis, but are just saying, look, I know I'm going the wrong direction. I'm overweight. I don't feel so great. And, I want to turn this around before something happens. This is the stuff that you would tell these people to do. And it works if you're a little bit further down the path of poor health as well. The anterior hippocampus will shrink 1% to 2% a year, COVID or no COVID. 120 adults started a walking program 3 times a week, and MRI showed exercise reversed shrinking and increased the anterior hippocampus, and their memory improved. So this is really simple, low-tech, low-cost stuff, right? It costs me nothing except having good shoes to go outside and run around a little bit in the sunshine today, right? You can do it too. Hyperbaric oxygen therapy is another option that's not particularly expensive. Insurance doesn't cover this. Insurance is not going to buy your running shoes, and it's not going to cover HBO, and it's not going to cover your probiotics. But I think we have to get away from the idea that if it's not covered by insurance, we're not willing to invest in it, because actually what your insurance should be used for is, you got hit by the bus kind of thing. So anyway, randomized sham-controlled double-blind trial. 73 patients with long COVID were randomized to treatment with hyperbaric oxygen therapy for 2 months or sham treatment. And the results, HBO resulted in improvements in brain fog, pain, energy, sleep, anxiety, and depression. Loss of smell, very common, many people complaining about it. Study of 24 people in 3 groups. People with prolonged loss of smell after COVID-19, normal sense of smell after SARS-CoV-2, never had COVID, had normal sense of smell. And the researchers analyzed biopsies of the mucosa, all right, and they were looking for the olfactory neurons are responsible for smell. And so findings regarding loss of smell, ongoing inflammatory signaling, reduction in the number of olfactory sensory neurons, T cells producing interferon gamma dendritic enrichment, depletion of macrophages. In other words, what you're finding there, it's like an autoimmune process in the nose, right? And so now you can kind of understand if it's all localized to the nose, the salt therapy may actually help that. Researchers randomized 120 people with loss of smell due to COVID to treatment with Flonase or a placebo, inexpensive over-the-counter product. Both smell and taste improved within 1 week in all patients using Flonase. 2009 randomized study showed that resensitization training improved sense of smell. This is all pre-COVID, where patients sniffed intense odors 2 times a day for 12 weeks, and they really did get the ability to improve their smell due to this exposure. There's little evidence to support supplements. There's a lot of hypothetical hypothesizing, like, well, based on this pathway, if you took this supplement, it should restore your smell. But my bet would be on either an antihistamine or salt therapy would be, or exposure therapy would be the ways to do this. Fatigue related to inflammation, a study including 37 long-haul COVID patients with and 36 without severe fatigue. They looked at inflammation-related monocyte gene expression, plasma levels of inflammatory cytokines, leukocyte and lymphocyte levels 3 to 6 months after hospital discharge, and followed symptoms for a year. The fatigued patients showed increased expression of inflammatory genes. That's the bottom line. So this is a disorder of immune function. So everything that I said yesterday about, immune function and nutrition and immune function it pertains to here. And again, my guess would be that, although this study didn't include it, that these people who have these symptoms, the long COVID symptoms, probably weren't in the best of health before. So if you were eating an inflammatory diet, carrying extra weight, you were sedentary and dehydrated before you got COVID, what happened is COVID just exacerbated the effect of all those bad habits and that bad state of health that you were in before. So fix that and this gets better. The benefits of water fasting, lots of them, right? One of them is, it's like, the way I describe it to people, and I've sent probably well over 500 people to water fasting centers here under medical supervision in a resting state, is it's like rebooting your computer. And I'm sure you've all had this experience. You get to the place where your computer just isn't functioning and it's slow and all that sort of thing. So you get rid of all the cookies and you restart the computer, and then things work fine for a good long time. That's the benefit of water fasting. It does need to be done under medical supervision. You have to be in a resting state. The duration of the fast should be determined by experienced people who know how to supervise fasting patients, and controlled refeeding is important for safety purposes as well. There are several fasting centers around the country. I don't think there's a day of any year, with the possible exception of 2020 and 2021, in the entirety of my career, that I haven't had at least one person fasting at some facility in the United States, because that's, and by the way, again, I emphasize needs to be an inpatient thing. Part of the reason is safety, and another part of the reason is in a resting state. And most people will tell you, if they're honest, that they can't be in a resting state even if they stay home. I mean, I am incapable just laying on the couch in this house for very long. There's always something I'm seeing that needs to be done, and the cat's flying around the room and all that. To lower inflammation, protect your microbiome. Taking probiotics restores beneficial gut bacteria, reduces inflammation, can help prevent and treat infections. And along that line, avoid conventionally raised animal foods and farmed fish, because they all contain antibiotics. And so you only want to take antibiotics when they're absolutely necessary. And there are times that they are. I mean, I had to take one in 1994 because I was bitten by a cat. And my body started to swell up and shut down within a very short period of time. I wouldn't be talking to you right now if I hadn't taken the antibiotic at that time. However, most people are taking antibiotics when they're not necessary. They're terribly overprescribed, and people are consuming antibiotics in conventionally raised animal foods and farmed fish without even knowing it. How you lower inflammation, which is the hallmark of all disease: hydration, weight loss, exercise. Some supplements like ginger and turmeric can have some usefulness, but only as adjuvants. In other words, a rheumatoid arthritis patient who's doing all the right things might benefit from adding turmeric to the regimen of health promoting activities. But the idea that and people take turmeric and ignore all the rest of that stuff. It's not magic stuff, right? None of these things are magic. Working at health is not a magical process. It's work. You have to work at being healthy, because if you don't work at being healthy, you're going to have to work really hard at recovering from being sick. And I'd rather do the former. So there's some other strategies that might help. I'm going to go back to heat. I actually prepared a 1-hour lecture on the historical use of heat and the use of sweat lodges and saunas. It's been traditional for a long, long time. Sauna bathing exposes people to high temperature for varying periods of time. It increases the body's core temperature, which has a positive effect on many, many functions in the body. The body, and people sometimes say they hate heat. That's one of the biggest objections to coming to my hot yoga studio, but you acclimate to it. Humans acclimate to anything. I mean, and this is just a funny thing I'll share with you. People will say sometimes, am I going to like your hot yoga? I tell them, well, not in the beginning. Nobody likes it in the beginning. It's hot, it's hard, it's 90 minutes. You're not used to the heat. You're not used to doing a lot of party tricks like balancing on one leg for a minute. So no, you're not going to like it in the beginning, but you'll acclimate. Saunas have been used safely for thousands of years all over the world, and the reported benefits are everything from spiritual growth to pain relief. And so there are several types of saunas, and which one you choose to use depends on you, but the type of heat, the level of humidity vary. There are several mechanisms by which saunas can improve health. And you'll see here impact on the central nervous system, autonomic nervous system, increased heart rate, blood flow, cardiac output, sweating, and increased nitric oxide production. In other words, there are specific benefits of sauna that are very much related to the specific pathologies of long COVID. However they started, whether it was COVID or it started before COVID, it doesn't really make any difference. You still have to solve the problem in order for people to enjoy health. The body needs to be stressed. That's part of the problem. All this sitting that people do, they never work up a sweat. They don't stress their body in any way. That is not good. So cardiac output improves. Heat tolerance develops as plasma volume increases to provide a reserve source of fluid for sweating. And sweating facilitates detoxification and can even induce excretion of metals such as aluminum, cadmium, cobalt, and lead. So humans are designed to sweat. And by the way, your skin will look better if you sweat. You'll feel better if you sweat. And sweating is, and people who don't sweat will actually start sweating if they work hard enough at it. Sometimes that's a problem. People haven't really worked up a sweat for a long, long time. Hormesis is a compensatory response following exposure to a stressor that's disproportionate to the magnitude of the stressor. It triggers protective mechanisms that repair cell damage, provides protection against more severe stressors. And other forms of hormetic stressors include exercise. So exercise stresses the body, makes you stronger, all right? There is no such thing as having a strong body and being healthy without stressing the body, which people are remarkably reluctant to do. We are comfort-seeking creatures to a certain extent, and we should be challenge-seeking creatures, both mentally to keep our brains in good shape and physically to keep our bodies and our brains in good shape. So a lot of these kinds of things, just again, some of the stuff goes way back before COVID. People should have been doing some of these things before. And the fact that they're having trouble getting well from COVID becomes the motivator to do it. Heat shock proteins are present in all cells and in extracellular spaces. They're involved in all kinds of things, including immune function. So they can prevent the protein aggregation and assist with cellular repair. So heat stress significantly increases intracellular levels of HSPs in humans. So that's a way to restore and improve immune function, all right? Inflammation is an important part of the natural immune response. We talked about that at length yesterday. Chronic low-grade inflammation, not so much, all right? Both exercise and sauna will increase the right type of inflammatory markers, right? So you want some inflammation and you want it for acute periods of time, but you don't want this low-level chronic inflammation with all the wrong markers that make you sick. Endothelial dysfunction, common in congestive heart failure, also common in long COVID. 2 weeks of sauna therapy was shown to improve endothelial function and cardiac function. Left ventricular dysfunction results in compensatory mechanisms, which is common after myocardial infarction, increases the risk of stroke. Single session and long-term use of sauna is shown to improve left ventricular function in men with congestive heart failure. So to the extent that cardiac comorbidities are common with COVID and long COVID, the sauna, the heat starts to make some sense. And then pain relief. To the extent that residual pain seems to accompany long COVID, patients with fibromyalgia, either with or without other conditions like lupus or rheumatoid arthritis, report improvements in pain and fewer tender points after 12 weeks of both combined sauna and underwater exercise therapy. And sauna bathing for 4 weeks was shown to improve pain and stiffness in patients with RA and ankylosing spondylosis, but the effect wasn't sustained after therapy ceased. Well, nothing is sustained after the therapy stops. In other words, if you're eating well and you stop eating well, you're not going to remain healthy. If you exercise and then you stop exercising. So if you're using the strategies that we're talking about here for therapy, you keep engaging in them if you want to remain healthy. And people say, well, it takes time. I'll tell you what takes a whole lot of time is being sick. And people will spend full time on it because they don't want to die, right? Or they're terrified. So don't wait till the terrified place to be doing some of the stuff that I'm talking about. Yoga can be very helpful. A review of 32 randomized controlled trials with over 2,700 participants. The control groups were people who got conventional treatment and education, aerobic exercise, cognitive therapy. Comparison of yogis with sedentary people. Those who practice yoga lowered their cholesterol, blood pressure, diastolic blood pressure, body mass index, triglycerides, all things related to general health, but post-COVID syndrome, right? Yoga compared with aerobic exercise, it was comparable in improving body mass index, weight, blood pressure, cholesterol, and triglycerides. It's an attractive alternative for people who can't do some forms of exercise. It's an attractive alternative no matter what else you can do. Full disclosure, I own a yoga studio. Having said that, I really, even before I owned this yoga studio, recognized the negative effects of not taking a yoga class if I were to go for, say, a week without yoga. The most miserable time I ever had, I'll just share this with you, was when I had my gums rebuilt. And I was the first person in the history of the clinic where they do this that had all 4 quadrants of the mouth done at the same time. I had 400 stitches in my mouth. And they told me that I couldn't go into the hot yoga room because if it all swelled up, they'd have to do it again. And it was really expensive and I couldn't afford to do it again. So long story short, I was not able to be in the hot yoga room for 3 weeks. And the physical deterioration during that 3 weeks, stiffness and just like feeling, kind of those aches and pains coming back, which I wasn't used to. You never saw anybody take so much yoga after that 3-week period was up. I was happy to do it to get this other problem solved, but boy, was it good to get back in that hot yoga room. Yoga and mental health. I mean, a lot of what I described to you earlier had to do with emotional and cognitive issues. A review of 35 trials that looked at the effect of yoga on stress and anxiety. 25 showed a significant decrease in stress and or anxiety. a meta-analysis of studies that looked at the effect of yoga on mental health. Yoga had a positive and measurable effect on depression, schizophrenia, even ADHD, sleep. Some studies show that yoga affects the body in the same way as antidepressants, which is a whole lot better option, I have to say. It increases serotonin levels, it lowers inflammation, reduces oxidative stress. Kundalini yoga is even effective for the treatment of OCD. So to the extent that some of what we're dealing with long COVID is emotional, psychosocial, yoga can be helpful. The other thing is that now that some of the world has gone back to normal, yoga is a group activity that involves being around health-minded people. I mean, we don't have people who don't care about their health taking classes at our yoga studio. So you are a product of the company you keep, and this is some good company to keep. Acupuncture for pain, and for those who have specific pain, while you're lowering the inflammation and getting your body moving again and taking some yoga classes and just kind of cleaning your internal house, acupuncture can be helpful. I'm not a fan of acupuncture as an isolated practice. And by the way, in traditional Chinese medicine, it's not practiced that way. Ancient healing systems like Ayurveda and TCM really promote a whole person approach to health. And so that's the way I like to see it included here. There's some evidence for acupuncture for long COVID, mostly case reports, but they can be instructive. Some of the mechanisms would be lowering inflammation, increasing production of nitric oxide, stimulated microcirculation, and regulation of the vagus nerve. So just think about if you did all this stuff, you started going to the sauna, taking yoga classes, exercising, aerobic exercising, eating a low-fat, high-fiber, plant-based diet. You start doing again, converting to a health-destroying to a health-promoting lifestyle. All kinds of problems go away. And again, I continue to emphasize this, the long COVID is just actually a constellation of symptoms that are common after infection, but usually have their origin from before the virus ever happened. Last thing I'll talk about here is hair loss is concerning, and hair loss seems to be a hallmark symptom of COVID that's different than other coronaviruses and colds and things of that nature. And so there's a lot of talk about biotin. I finally decided to write a paper about it because so many people were asking. So I'll tell you what we know about it and give you some recommendations. So it's a B family vitamin. It helps to convert nutrients into energy. It contributes to the health of eyes, liver, and nervous system. Important for fetal development. It's water soluble. The body doesn't store it. It's abundantly available in food. In other words, biotin deficiencies are just, I've never heard of it before. The gut microbiota in humans produces a little bit of B vitamin, including biotin. The only way you could have a deficiency is if you weren't eating enough calories, then you become deficient in everything. There is no RDA established, but it's easy to meet with food. A deficiency can lead to hair loss, but it's not thought that that's what's going on since almost nobody is deficient. So potential causes of deficiency for those who might have it would be bad habits, alcoholism, smoking, if you're sick enough to need parenteral nutrition, drugs for epilepsy, acne drugs. So to the extent that anybody might need extra biotin, it would be because of relatively extraordinary circumstances. I would imagine if you're taking Sunday morning to spend time with me, you're probably not an alcoholic who's smoking cigarettes during this lecture, right? So kind of not the usual person. In terms of using biotin for hair growth, the studies are mixed. One review reported that only those who have a confirmed biotin deficiency benefit from supplementation. Another group conducted a PubMed search of all case reports and RCTs on human subjects, and they found no RCTs, but identified 18 case reports or case series of biotin use for hair and nail repair or growth. All subjects had identifiable causes for their issues, and all showed some evidence of improvement after taking biotin. The researchers concluded that biotin is effective for people who have known deficiencies, and it's not effective for healthy people, but then a healthy person wouldn't be experiencing hair loss, right? An industry-funded study, a supplement containing biotin and some other nutrients, was effective for hair regrowth in women generally in good health who had self-perceived thinning hair. For women taking biotin, the number of terminal hairs increased from 271 to 571 after 3 months of treatment, and at 6 months increased to 609 hairs, extra hairs coming up. No change in the placebo group. And the women who took the supplement also said that there was improvement in their overall hair volume and thickness. So this is a subjective report, and we have to take it with some caution, but still, it's there. The study was randomized, double-blinded, placebo-controlled, but the study design was not so great. The supplement contained other vitamins and minerals, so you can't really go, attribute the success to the biotin alone. Women were excluded from the study who had conditions that might lead to hair loss, for example, autoimmune diseases. And the results most likely are irrelevant for most women, considering biotin is a solution for thinning hair. So, and it was, again, industry funded. There's some evidence of efficacy for children with a rare condition called uncombable hair syndrome. I just saw a news story on this. It's dry, blonde, tangled hair. And 2 young patients with uncombable hair were given 5 milligrams of biotin daily. Both showed improvement in the appearance of their hair, maintained after supplementation was stopped. Another study that included 3 kids with uncombable hair, oral biotin for 4 months resulted in increased growth strength and compatibility in 1 out of the 3. So there's no evidence that it's toxic. There's no upper limit that's been established, which is not necessarily meaning that you can take as much as you want and there's no problem. It means it's never been looked at. The only side effect that I could find that was worth mentioning and something that you should be aware of is that if you're taking high intakes of biotin, so for example, 5,000 milligrams a day is often recommended for hair growth, it may alter your lab tests for thyroid hormone. So you either stop taking the biotin a couple weeks before your blood test, if you're seeing your physician for an annual visit or something of that nature, or you tell your doctor not to pay any attention. I mean, this would not work if you were a hypothyroid patient needing a refill for a prescription. But the other thing is you can just tell your doctor, ignore my thyroid panel because that's going to be skewed because I've been taking biotin for hair growth for a long time. So again, I don't know that we can guarantee that the use of biotin will grow hair, but I don't really know that there's anything harmful about it except the warning about blood tests. So certainly worth trying, and a lot of my clients have done that. The average dose appears to be 2.5 to 5,000 micrograms a day. Most published studies are short term, so you probably would have to take it longer to see a change. So we don't have any idea, what the duration of treatment should be, just a lot of unknowns. But again, to the extent that particularly women find hair loss alarming, and for good, I mean, we all want to look good. I totally understand that. It might be something that you want to consider. So my conclusions, and then we can go to questions, are that symptoms, sometimes very long-term, often follow infections with a variety of pathogens. So the fact that we have symptoms after COVID, not shocking, somewhat to be expected, but just maybe hyped a little bit more, and maybe with a couple of little different twists because of the very nature of that spike protein. But we need to come off the ledge and just look at this from a logical standpoint. Pre-infection health and psychological state are very important factors for the development of post-infection sequelae. And addressing pre-infection physical and psychological health issues is an important first step. And there's such a wide variety of symptoms and this sort of thing that everybody has to be treated as an individual person. And again, with a history, going back and looking at what have you been eating, what have you been drinking, what's your health status, what drugs were you taking, and taking the same whole person approach that we would take whatever somebody came into the office with, right? I've always said I don't just want to be part of the reductionist model of medicine where people see a gastroenterologist and a nephrologist and a rheumatologist and an endocrinologist and a gynecologist. I mean, everybody's specializing in a body part. Come over here, we'll teach you how to eat, and we're just part of the reductionist thing. You have to look at the totality of your health and your habits and everything else, and use a whole person approach. So to a certain extent, long COVID is just like every day at the office for us. And many times it isn't really long COVID, it's just poor health exacerbated by having a pretty serious case of the flu. So I hope that that was helpful in outlining this for you, and we can take the rest of the time to have questions. Like I said, I've given you the hour-and-a-half version. The long version would take the rest of the conference and would crowd out a lot of other people, but I think I got the general idea across.
Great. Thank you so much, Doctor. That was very informative, and it really puts things into perspective. So now we're going to begin our Q&A, and I just want to go over a few things for the audience. We don't take questions directly from chat. What we do is we request that you raise your hand in Zoom. If you're not familiar with that process, you just need to go to the reactions button, second from the right at the bottom of the Zoom window, click on that button, and then click on the raise hand function in the menu that pops up. When I call on you, just please state where you're from and ask your question. And we just ask that your questions are brief and on topic. And I see we got a few hands already raised. So I want to, go ahead and get a participant here. Debbie, where are you from and what is your question?
Hi, yeah, it's Debbie from Duxbury, Massachusetts. I have a couple of questions, if that's okay. First of all, just back on the biotin that you were talking about, and if you take so much and then get your thyroid test, would that indicate that, what does it make your thyroid medicine not work and they're going to prescribe more, or does it look like it's working too well and they prescribe less? I'm like a little concerned because I've been on biotin and I just checked it and it's like 1,000 a day, and I never adjusted that for like my tests, and I'm going to see my doctor soon in a couple months. I'm going to cut it back because I have thyroid. I'm on that stuff.
Well, a couple of things. If you're actually trying to regrow hair, you're probably going to want to take a higher dose.
And if you actually, what's going on?
What's that?
Sorry,
Okay. So if you're actually trying to grow hair, you're going to want to take a higher dose. And if you actually have hypothyroidism and require medication, you're going to want to stop taking it before you have a blood test so you get an accurate reading and you're not over or under medicated. So in the case of, I don't have hypothyroidism. So if I were taking, I don't have anything wrong with my thyroid. So if for whatever reason I had a doctor's appointment on July 1st, all right, and I'm taking biotin, there's no reason to stop taking it because I would just tell my physician, I don't need to have my thyroid tested. And if it is included in this lab test you're going to run, it doesn't matter what it says. I know it's going to be skewed because I'm taking the supplement right now, right? So in your case, I think what you want to do is up the dose if you're trying to grow hair with it. If you're not trying to grow hair with it, I can't fathom what its usefulness would be. But if you are trying to grow hair with it, a higher dose would be better, and then just stop taking it so that you get a good reading on your blood test when you get your thyroid panel back.
I'm so sorry. I had to take care of something. So there you go. Now we're even for the video thing. Yes. So a lot of people gain 15, 20 pounds during COVID. How much was that a factor in people's perception of their poor health after COVID?
A huge perception. First of all, if you gained a lot of weight, most people lose weight when they have the flu, all right, because of the vomiting and the diarrhea and all that sort of thing, if you had a severe case of it. So if you actually started gaining weight after that to the place where you have 20 pounds to take off or whatever, every pound of fat that you carry that you don't need is producing inflammatory cytokines, right? So a generalized level of inflammation that contributes to almost any disease that you don't want to get. Plus the habits that lead to weight gain. You're either not exercising enough or you're eating too much fat. Eating too much fat injures your cardiovascular system and preferentially feeds pathogens in your gut and all that sort of thing. So weight is just a wake-up call that something's not right. That's what the way you treat weight. We don't want to shame people for being overweight, but we've gotten to a place in our society where it's considered politically incorrect to talk about it. We got to start talking about it. When you're carrying around a lot of extra weight, and a lot of extra weight is really I mean, 5 pounds is not going to hurt you, but people walking around with 10, 20, 30, 40, 50 pounds of extra weight, that is a health risk.
And well, along those lines, is there, talking about politically correct, there's an idea that you can be overweight and healthy. Is that a reality?
Well, I'll tell you this. Start reading centenarian stories online. You can read them till the end of days because a lot of people around the world really do live to be 100. Try to find a fat centenarian. There's not a single one I've ever seen. All right. So you're not going to, the more weight you carry, the more likely you are to die prematurely. And it's a marker for health. It's not about, I mean, people want to look nice. I've never met anybody who just is honest, who says, I don't care what I look like, right? But it's a marker for health. If you're carrying extra weight, something is wrong and you want to fix it. It's easier to fix a minor problem now than it is to fix a major problem later. And I have a theory, I don't know if it's true or not, but I would bet money it is, that from birth to death, everybody in this group will spend the same amount of time and money on health. I'm spending it on yoga and food and gym. I don't have to buy gym membership. I own a gym, but I'm investing the time and money in health. Some people are investing the time and money in sickness. My mother did that. My father, when we got the bills for my mother's illness, the last couple of years she was alive, my father provided a lot of supplemental things for her, like 24-hour nursing and all that kind of stuff. Medicare paid $1 million. My dad paid $1 million. That's a lot of money. It's a lot of money, and for a awful quality of life. I wouldn't wish the last 15 years of my mother's life on anybody, including people I don't like. Okay. So just think about it. You're going to spend time, you're going to spend money. What are you going to spend it on? Spend it on getting yourself healthy and stop looking. And I know from experience, because I used to be fat. Nobody here knew me when I was fat. But I remember when I used to think, well, I took off 10 pounds, I'm good. No, I wasn't. I was still the size of a house. Well, I'll wear black. It makes me look thinner. When you're the size of the house, black does not make you look thinner. I'm just going to tell you right now, it does not help, right? So I had to get honest with myself at some point in time and say, look, this is not good, and I'll share this with you. I haven't told a lot of people about this, but a person I went to high school with sent me a picture of recently of when I visited her in Florida. We lost track of each other after this, but anyway, 3 years after high school, I visited her in Florida for a couple of days. So it's the two of us sitting around the pool. And she said, I'm sending this to you not to make you feel bad, but so you can see where you came from, and I was huge. I couldn't believe it. I didn't even recognize myself. If you saw this picture, it doesn't even look like my face, right? And I remember back then thinking, it's not so bad. What a delusional mind I had at that point in time. So I kind of went off on a tangent there, but we've just got to get to the place where we think it's okay to carry extra weight, not because of some judgment about your appearance, but because it's just so detrimental to health.
And loss of smell, which you touched on, was obviously a major thing, especially with the initial variant that came out. Everyone, a lot of people have lost their sense of smell. Many people have not regained that. Are there other things, like you mentioned, the salt caves can remediate that? Are there other things that may have contributed to people losing their sense of smell, or does the research show that the loss of smell was in fact due to the COVID virus?
It seems like it was due to COVID, and it seems like it's related to the spike protein, which is how it was engineered to be so infectious in the beginning. I mean, that's truly what happened. Here's what we've noticed. This is another one of these things that appears to get better with time. It's just over a long time. All right. So I was just talking to a yoga student after class a few days ago who had this happen. She was in great health. In fact, that's the only residual symptom that she had from COVID was the loss of smell. And what she told me is what I'm hearing from a lot of people. So no smell, then a sense of smell that appears deranged, like I'm smelling something, but it doesn't, like I'm smelling something that has cinnamon in it, but it doesn't smell like cinnamon to me. And then gradually it is restored. I think you can speed it up with the salt caves, and you might be able to speed it up with something like Flonase, but we don't know anything at this point in time that works better than that, time and those things.
Great, thank you. Our next question is coming from Rochelle. Where are you from, and what is your question?
Hi, I'm Rochelle. I'm from Long Beach, and I have a couple of questions. Me and my husband both contracted COVID, and I had a very mild version, lasted a few days. My husband had it twice, and he had it more severe the first time. He was on the couch for like 3 months. But so long term, and we're both health conscious. I just want to mention that we both plant-based diet, exercise, no, conditions, no chronic conditions. So what he has is this cough. We call it the COVID cough. He has this cough every morning, and he can't seem to get rid of that. And I found like respiratory, I don't have the stamina I used to have. I used to, like if I'd run, anaerobically, I run out of breath. So I'm just wondering what you could suggest for that, or why that's still happening.
Well, it's difficult to say without looking at your health history, because I'm not saying that you're not telling me the truth. Please don't misunderstand what I'm saying, but we get people all day long who tell me that I can't understand how this happened to me because I'm in good health and I do all the right things. And then when we take a look at the actual story, it's not quite all the right things, right? So I don't know. But what I would tell you is two things. Number one, you may have to rebuild your aerobic fitness just the way you built it in the first place. In other words, when I'll share this with you, I got dared. I was not a runner. I got dared into running a marathon when I was on stage with my then boss in front of 5,000 people. And I said I wasn't a runner. And he said, well, apparently you don't think you can do it. And I said, well, I can do it, So anyway, having never run before, I went to a park where they have it marked, what the distance is. I made it a quarter of a mile running. I fell into the grass. Honest to God, I thought they were going to have to airlift me out of there by helicopter. That's how much wheezing and shortness of breath. And I did later that year run the New York City Marathon and finished it. So my point is that coming from a point of no aerobic capacity at all, which is where my starting point was, I got to the place where I could run 26.2 miles and walk back to the hotel and join my friends for dinner, right? So you may have to just go through that rebuilding process, and it's not fun. It wasn't fun then, and it's not going to be fun right now. The salt room may help your husband a lot, and neti pots and things of that nature. Salt halotherapy may clean that out. And an antihistamine might be worth exploring too. I would not do that necessarily. If you're going to start using some drugs of any type, I think I'd work with somebody on that. But the cautious use of a couple of drugs may not be a bad idea.
So thank you. So you had mentioned nitric oxide during your presentation. What are symptoms of having low nitric oxide that people can recognize?
Well, I'll tell you what, that's the problem. If I was queen of the universe, which I think I'd be great at it, just to let you know, I'm kidding. But if I was queen of the universe, I would re-engineer humans to just add one thing: pain receptors in your blood vessels, so that when you're eating a high-fat diet, your endothelial cells are being injured, you'd have pain. Well, if you look at the miles and miles of blood vessels in your body, you'd be in the fetal position on the kitchen floor, and then you'd never do it again, right? But the problem is that when you're talking about conditions of the cardiovascular system, often you're completely asymptomatic until something happens. That's the problem. So you have to use your intellect, right? It's the same thing with your brain, which is very related to your cardiovascular system. By the time that you recognize that you're not very good at memorizing things anymore, that you're losing your ability to recall names, and gosh, it's just hard for you to read and that sort of thing, there's already a whole lot of damage done because there's no alarm bells going off up there that you're storing tissue, So I don't know that you really recognize the symptoms as much as you look at the state of health that you're in and your habits and say, how did these reconcile with living to be 100? And I'll say something about that too. People tell me all the time that they don't care about living to be 100. I've had 88-year-old people sitting in my office who didn't think they wanted to live to be 100 until they were not going to be able to, and they're making deals with God. I'll do anything, if you can help me get over this and I can live my full lifespan. It's actually pretty sweet down here on earth. And we're all going someplace afterwards, but we all like it here, whether you may not recognize that right now. So pay attention to your habits when you've got a chance to do it without being panicked about something.
Great. Our next question is coming from Alice. Where are you from and what's your question?
Southern California. I'm out in the sun daily, although for years I've had critically low vitamin D, like in the 20s. I've been on for a really long time, 50,000 units prescription one time a week and 10,000 over the counter. So that's like 120,000 a week. And that just seems astronomical. They keep saying it's just a vitamin, it's not a problem, but it's a hormone. And so I am concerned about my bones and teeth and cancer and everything else. I am healthy, a little overweight, but anyway, what's your thoughts?
Well, my thoughts are you're taking horse-like doses of a hormone that's stored in your fat tissue, and nobody knows the consequences of that. So we're doing incredibly dangerous experiments on humans, which is seeming to be more and more acceptable in our culture today. I'm very concerned about it. Vitamin D is a hormone, and it's produced. The definition of a vitamin is something that your body cannot produce and must be consumed in food. Well, there is no vitamin D in food, and your body produces it. So this is a very dangerous path you're on, in my opinion. The way to get vitamin D, and by the way, your vitamin D levels used to be considered normal at 10.5, and children with rickets and people who had tuberculosis were put out in the sun until they got better. This is what we used to do before the world went mad. So get out in the sun and produce some vitamin D. And if you're healthy, but you're not healthy if you're a little overweight, you need to take that weight off. All right. So you should be paying attention to the things that really matter. But this whole vitamin D hoax is just one more thing that's been perpetrated by thoughtless, careless people who just don't read the medical literature. I was astounded. I made a little bit of a snarky video yesterday, and I thought about not posting it, but I'm gonna. And so the reason is I had posted a vitamin D video last Tuesday, and then I got all these people writing to me about this video that was made by John Campbell that showed the opposite of what I was saying. This vitamin D is terrific and it works. Okay, so John Campbell's a Ph.D. medical professional. A lot of people who sent it to me are medical professionals. And basically what this study said, watched the video, read the study, is that psychiatric patients in an inpatient facility given up to 50,000 international units of vitamin D weekly, by the end of 7 years, 418 patients had a vitamin D range of 118 to 384. And they deemed it safe because they tested calcium levels and they didn't go up. Now, if you're a health professional and you sent that to me trying to refute my stance that this vitamin D supplementation is dangerous and it doesn't improve health, tell me what health markers improved. What improved? Nobody left the psychiatric institution. Nothing of it. What they basically said is evidence of safety was your calcium levels weren't too high, and success was deemed enormous high doses never achieved before of vitamin D because we all just think it's swell. So I said at the end, if you're a health professional who sent this to me, you obviously don't know how to read the medical literature. Please enroll in my courses before you hurt somebody. And if you're a consumer, we can't blame you so much, but if you thought that this was a good idea, you also should be taking our courses before you hurt yourself. And I'm serious about that. Like I said, it's a little bit snarky, but it's just hard to imagine that we've gotten to a place where this kind of nonsense is promoted by people who are supposed to know better.
So the assumption with this whole vitamin D thing is that people are deficient, right? I've been hearing this for
Well, that's the business model. Everybody's deficient. Now you got to get tested. And there's no accounting for the different times of day. We absolutely know from case reports that vitamin D levels fluctuate throughout the day. Read these studies. There is no accounting for that. And the other thing is there's no accounting for what we know is true, which is that vitamin D levels are lowered when there is inflammation in the body. So you take an overweight sick person, of course their D levels are going to be low, and then inflate the reference ranges, everybody's low. Like I said, it's a great business model. By the way, it's the same business model that the cardiovascular profession and the drug companies use for statin drugs. You can't have low enough cholesterol. And they keep changing the reference ranges to the place where if people in my age range, 75% of us who have nothing wrong with this qualify for taking a statin drug. Now, in what universe does that sound like a good idea? And it goes on in the natural health field, and it goes on in the conventional health field, and it's despicable. And it's not the problem. The consumers, I'm just at a place right now. The way you fix healthcare is you dry up the demand for this horse manure by educating consumers, because it really doesn't matter if your doctor wants to dose you with high horse-like doses of hormone. You have to know how to say no.
So, given our lifestyle changes and we're no longer in the sun like we used to be, is there any research to suggest that we are deficient? And is there any research to suggest what the health consequences are if we are actually deficient?
Yeah, well, the health consequences of avoiding the sun are the same as the health consequences of smoking cigarettes. So that's another thing we got to get honest about, because the storyline not only is everybody deficient, you all got to get tested, you all got to take vitamin D, and there is no limit to how much of it we're going to stick in your body to reach ever increasing reference ranges. But you got to stop going out in the sun, because that's dangerous. You're going to get skin cancer. So you slather sunscreen all over yourself to go get the mail. And so you've got two dangerous things going on: horse-like doses of hormone and sun avoidance. And people are being told you should not tan. All right, you absolutely tan. By the way, when you tan during the summer, you store vitamin D for the winter. All right, so by about this time, I got one of the reasons I'm going to go outside today. It's time for me to start working on tanning. It's May. I've used up my vitamin D stores. Time for me to have get out in the sun.
And Colin Campbell talks about how a reductionist society and our medicine, medical model is reductionist, and we like to take the vitamin or whatever it is out of the food, and it changes the way it operates in our body. Does supplements with D is that the same type of thing where going into the sun has a certain whole reaction, like whole food, where supplementing with D, we don't know what it does? Is it similar?
Well, that to your point, when you get out in the sun, your body produces 10 types of vitamin D and thousands of photoproducts, including nitric oxide, which keeps your blood vessels open. All right. So this idea of taking vitamin D pills and slathering sunscreen and staying inside, just on its face, the logic of it is almost insane. And don't you just wonder how human beings survived to the place that we could be here having this discussion today without all this intervention? And we keep inventing more intervention because it's profitable. There's money in this. There are billions of dollars being made in vitamin D, and that's why none of this stuff ever goes away. The profit incentive is incredible.
And just last question on D, is there any food that we can eat that would aid in the production of vitamin D when we do get out into the sun?
No. I mean, well, I shouldn't say that. There are foods that you eat that aid in not burning, like the same types of phytochemicals that protect a tomato from just shriveling up and dying in the sun protect you when you eat the tomato, right? So there's some good reasons to eat a healthy diet, but your body will do just fine producing vitamin D in response to sunlight. And by the way, I want to be crystal clear about this. Tanning is good, burning is bad, and we don't ever want to burn the skin. So you have to build your tolerance. So I'm not going to be outside for an hour and a half in the sun today, all right? Because it's really shining, it's nice. So I'll go for a half-hour run, maybe lay out for 15 minutes on each side. That's about what I can do with my complexion. Somebody else might have to limit it to 15 or 20 minutes based on their complexion.
Great. Thank you. Deborah, where are you from? What's your question?
Hi, good morning. Thank you, Dr. Pam. This is Deb from Massachusetts/Florida. Good to see you. Okay, I have two questions. One is the taking a probiotic for microbiome. Is there any difference with taking it with or without food, or the time of day? Is there any benefit to that? And my other question is water irrigation for the gums with hydrogen peroxide, because you did mention about the your mouth issue, and so I was wondering, have you found any benefit from water irrigation with those little machines with hydrogen peroxide to help for the gums?
Doesn't matter what time of day you take the probiotic, but it should be taken with food. So enough of it will survive to get down to the lower GI without this stomach acid burning it all up. The hydrogen peroxide water irrigation, I haven't looked into. I'll put it on my list of things to look into. I can't imagine how it would hurt. Whether or not it's necessary would be a different story. There's just only so many compliance genes people have. You got to make sure you use them up on stuff that really matters, right?
All right, great. And our next question is coming from Gail. Where are you from and what's your question?
Hi, I'm from Boise, Idaho. I love listening to your daily video every day, Pam. Appreciate all your information. I just had a question relating to the other question about probiotics. It said, you know, how it can, the stomach acids can destroy them. And I get it, eating it with food. But my question was, if stomach acids can destroy probiotics, why wouldn't fermented foods, which contain probiotics, be the same thing? But maybe you have kind of answered the question already, because the food itself,
fermented foods are not probiotics. And if you like them, eat them. If you don't, it doesn't matter. Like if you went your whole life and never ate any sauerkraut, you can have a great microbiome anyway. And they're not a substitute for probiotics. You're going to have destruction of the bacteria, even with eating with food, but enough will survive to get to the lower GI to populate. So that's why you want to consume them with food. And yes, your stomach acid will still destroy some, but some will get through. And so that's the objective of eating with food, not to preserve all of it, but to get some of it down there.
Okay, thank you very much. Appreciate that.
So during your presentation, you mentioned that drinking water that has gone through the process of reverse osmosis is bad in the long run, right? Maybe for a fast it might be okay, but for the long term, it's bad for you. Our water is so toxic, the municipal water, and the environmental working group has a database on all the chemicals in the municipal water for all the different areas, and then they'll suggest, or they'll say what kind of filters take out which kind of chemicals. Reverse osmosis is one of them. Given what you're saying about reverse osmosis being dangerous for our health, is there a good way to filter out our water of all these toxic chemicals?
All right. So the first thing is that, yeah, we have a lot of toxic chemicals in our water and in our environment and all that sort of thing. But you probably have heard this before. The dose is the poison, and the host determines if it's a poison or not too. So I just read a book on glyphosate that was incredibly disappointing, because if the objective was to get people to be concerned about glyphosate, it had the opposite effect on me. It was so poorly written, and the research that was cited was so bad that it makes you think the whole thing must be horse manure, right? So I'm very cautious. This is another thing we could do a workshop. We could spend a whole hour and a half or two on it. But a good example of an argument for reverse osmosis is it takes the fluoride out of the water. All right, so I don't like water fluoridation. But you can't even find a case report of a person who has shown up in some doctor's office with a disease that was brought about by fluoride in the water, that was resolved when the fluoride in the water was no longer an issue. Not even a case report, the weakest form of evidence that you can find, right? So it's possible for two things to be true at the same time: that you would like for the water to not be fluoridated, but that our problem is not fluoridation. Our problem is electrolyte deficiency that results from consuming something that has a pH of 5.7. All right, some of the same people who are recommending reverse osmosis water are telling you all the time about the dangers of consuming a food pattern, a dietary pattern that induces that same state in the body, right? And so, sometimes it's the lesser of evils. The other thing is, you'd be surprised what inexpensive carbon filters take out at point of use. They take out, for example, the phenyl chloride that was released into the water in Ohio as a result of the train derailment. Carbon's very effective for taking that out. So what I tell people is, I do think that tap water should be filtered because of the chlorine and the disinfectants. You'll get a lot of stuff out with a good carbon filter, including the vinyl chloride, and if there is any that is drifted over this way. And you're going to live with some toxins in the water that we don't really have any evidence are causing any of the diseases that we're talking to people about. I've never understood how somebody could make the claim that glyphosate, for example, which is taken out by water, by carbon, causes type 2 diabetes. Type 2 diabetes is caused by fat consumption. I mean, so unless glyphosate is forcing people to eat more fat, I don't get the connection at all. So anyway, as a long answer, the longest one I can give in the context of how much time we have, which really isn't enough to explore it fully, but I would disagree with the recommendation of reverse osmosis because of chemicals in the water.
Okay, and we have 3 minutes left. So why don't I ask you about glyphosate and the dangers of Roundup, which actually contains a lot more chemicals in it than just glyphosate. Is that something that we should be concerned about? We've had speakers talk about glyphosate and cancer and all different kinds of diseases. What are your
I've
thoughts?
never seen a connection. And again, it's possible to think that Monsanto is a terrible company. It is. They have business partners in the government. They do. Glyphosate is toxic. It is. Is it causing cancer? We don't know. All right. It's a list on the list of potential carcinogens. So is aloe vera on the same list. You can go look it up. All right. So again, we have to make sure we're not barking up the wrong tree here in terms of all of this stuff. The other thing is that even the court cases, people will say, yes, but that guy who was using glyphosate at the school, he won $50 million. That's what happened with tobacco. Believe it or not, the tobacco lawsuits were lost on this premise as well, because people came in and would win these jury awards. Juries would feel sorry for them. And it sounds like I'm pro-smoking. I'm not. I'm pro-reality, right? And how they got reversed on appeal is Lorillard would say, and sometimes even in the lower courts, Lorillard would say, look, Mrs. Jones was overweight, diabetic, all right, taking 4 medications, and you're going to say she died because of Lorillard? Are you kidding me? Seriously, right? So it's a complicated issue, and this very simplistic reductionist view that glyphosate's killing us all. And I mean, I've even had in this book that I just read, which is very disappointing, it's really not that we don't exercise enough. That's not why we're fat. It's glyphosate. And seriously, the fact that a person with a Ph.D. from a prestigious school would make that argument, boy, that tells you what's wrong in medicine right there, right?
So should we try to go out of our way to pay extra for organic foods?
I think it's a good idea, but it's also one that tends to have the reverse effect. Most people are economically stressed right now. Groceries are more expensive than they've ever been. So it's sort of like the intermittent fasting. Let's stick another barrier to eating good food and make people think it isn't worth doing unless you can buy organic food and it's 4 times expensive and I can't afford it. So maybe take out chicken is better, right? So I think we have to be very careful that in the context of the world we live in, we're making recommendations to people that are actionable, that actually can be actionable, and by most people. So I think one of the things that's going to happen, I'll just finish with this, is that the food shortages and cost of food are going to drive people to purchase food from farmers. And it'll be better quality food, and the price issue will somewhat be addressed by that. But that has to be done in co-ops and groups of people, which we're organizing through our nonprofit.
Okay, great. And so you've got like 30 seconds left. Do you want to talk about that nonprofit in 30 seconds?
Yeah, we want to form foundation. We're setting up groups all over the country that we call them forming your tribe for survival. You can't pull into the driveway of a farmer and order 2 steaks and 5 heads of broccoli, but you can put together a buying group that does that. And just to contact me, my email address is pampopper@msn.com. My company's website is wellnessforumhealth.com. And it's always a pleasure. I enjoy this conference every year. The questions are always great, and I look forward to it.
All right, great. Thank you. You might just get an email from me. So thank you for your time. If we could unmute the audience, please. All right.
Thank you. Thank you.
Thank you so much. That was great.
And you're just gonna get